Hi, my name is Samantha Spear, and for my project, I chose multiple sclerosis. The reason I chose multiple sclerosis is because of my one of my old teachers. Her husband has had multiple sclerosis for years, and I never really knew what it was, and wanted to learn more about it and how it affected everybody that for everyone that the patient is involved with, like their loved ones. And this is what I found out. Multiple sclerosis is an immune disease. All it attacks the covering of your myelin sheath, and when your myelin sheath is damaged, it disrupts the communication between the brain and the rest of the body, and just makes it harder to function as normal. And this can be very hard to do everyday tasks. MS is currently unknown for a cause. Um, they have no idea what causes it. They think that it could be part of infections from a childhood disease, or infections from your childhood, or genetics, but they are uncertain why it affects certain people with the genetics and certain infections. So that's also why they have no idea what causes it and why it's so aggressive in certain people, but in others it's very minimal, or it doesn't affect them as much as others, where it affects them greatly. Some cells, tissues, and organs that are affected by MS are obviously the brain because of the damaged myelin sheath. It disrupts it disrupts communication between the brain and the rest of the body. And it can cause some circulatory system issues, but that also has to do with the patient having weak chest muscles, also another weak respiratory system, making it hard to breathe. It also does affect the lungs, obviously, and then the bones, your muscles, your limbs, and it just can make everyday things difficult. Like having your morning coffee can make it a lot difficult if you can't grab onto that cup or breathe while you're drinking your coffee and stuff like that. Cells and other more cells, tissues, and organs that are affected by MS are your limbs, because your limbs can become tingly and have some numbness, and same with your arms. So walking, grabbing things can be difficult to do. And then with multiple sclerosis, patients often developed osteoporosis, a bone disease, and can have a higher risk of getting broken bones, fractures, weak muscles, or weak bones, and can just put them in the hospital even more. And actually, this picture that I have up here is actually some steroids that they use for MS. It also can affect your bladder. About 10 out of, or 8 out of 10 people will experience diarrhea or constipation, and it also can cause a lot of UTI infections and also kidney infections, because your bladder just can't hold it anymore, or you just don't know that you have to go to the bathroom, and then you end up with UTI infections and kidney infections, and that's just not good. It also can affect your reproductive system. Um, Sometimes it's just harder to get going with some people, and some women actually found it relieving their symptoms if they got pregnant, which I thought was weird because I don't understand how or I didn't understand how being pregnant would relieve some of your symptoms, but I guess some women do that. And and then I guess and then about 2 out of 4 women, 2 to 4 in 10 women will also experience a relapse during the postpartum period, and this can also cause some fatigue and pain, and it just makes it hard to be intimate with your loved one or your companion. Some signs and symptoms are some muscle spasms, difficulty looking up and down. It's really painful, and then some difficulty walking, some numbness and tingling, as I stated earlier, in your arms and your legs, fatigue, bladder problems, dizziness, memory loss, speech problems, and also in this really awesome picture I found where it shows the percentages of people who have these. There's also like depression, cognitive function problems, um, and many other problems besides what I have on the screen. But I just thought it was really interesting that that I found this picture and you can see that like 14.7% of people with MS are have depression, and 5.7 people or 5.7% of people have bowel dysfunction, or 11.1% have bladder dysfunction. I just thought that was really interesting that I found that guy. And then some treatments and preventions. The treatment of MS all really depends on how severe it is, how it's affecting your body, and it's just like it's all kind of like hit and miss. Like if you're having certain issues, they might try something different than the next person because their symptoms and issues with MS could greatly differ from yours. And then some at-home treatments can help too, such as physical therapy and occupational therapy. And there's also some vitamins and supplements that could help or relieve some of your symptoms with MS. And also, people who are common to relapse or are believed that they could possibly relapse are also given certain medicines to help control it, so if they do relapse, it's not going to be as severe. Okay, and then more treatments and prevention. Just monitoring it helps a lot, and then making some appointments to um, treat and see how your motor symptoms are functioning, see if they're getting worse or if they're getting better, so they can adjust the medicine or your treatments that you're taking. And there actually is no way that you can prevent MS. If you're gonna get MS sometime in your lifetime, you're gonna get it. There's nothing that they can do. There's no cure, and there's no known cause of MS as of this time. Some long and short-term effects of MS um, are just like taking some prescription medicine, some alternative therapy is also really good, even though it hasn't been extensively researched as well as much as like the medicine for MS. But there is a percentage of people who found that the alternative treatments, such as their physical therapy and home remedies, have found out that that actually helps. Even though it might be just a little bit, it helps, and that's what's good about it. And then, as in the picture, you can see that over-the-counter medicine is helpful about 30 or is about 30% effective, and then or is used about 30% of the time, and then 10.3% of patients use like rehabilitation therapy, 28.5 are alternative therapy and stuff like that. So there's more than one way to treat MS. Even and just it's just because everything's different and everyone is affected differently. So the treatment plan has to be somewhat for you, because part of your treatment plan might help somebody else, but the other part of it might not because theirs is so different. And that is my presentation. Here are my references. And I hope you enjoyed learning about MS.